Hey everybody, welcome back. This is Screencast 13. I am your instructor, Dr. Toby Brooks, and we're there. We're finally to the point where we've discussed the prime movers, a lot of the stabilizers, some of the synergists. We've made our way through the skeletal and muscular anatomy, and now we've kind of reached the so what point. So my hope for lessons, or screencasts rather, 13 and 14, are that we're going to be able to put those things into practice. Now I will tell you, I've taught this class in person, and now this being the second time around that I've taught it online. Ordinarily in class we'd get together, we'd do a motion analysis project where we would actually apply this to a particular sport skill. But online doesn't really lend itself to that kind of a project. So you're going to have to kind of trust me, and I'm also going to have to trust you that as you go through this lesson, you're looking for ways to put your newfound knowledge into practice. So this is really the application portion of what we're learning. So our goals for today are to look at the upper extremity, in particular the throwing motion, common in pitching. We could apply that to some other overhand sport skills as well. We'll take a look at the kinetic chain. Many of you have mentioned you're interested in a career in therapy or healthcare of some sort, so that will be important in your future. And then we will look at a specific exercise and see how our knowledge of musculoskeletal anatomy can play a role in exercise prescription and in coaching. Okay, so first things first, we divide any motion into phases. Now in my strength and conditioning class that I teach at the Health Sciences Center, we will do what's called a skill set project. And in that project, we'll take 18 common lifts, anything from a hang clean, a snatch, all the way down to something like a bench press or a bicep curl. And the students are required to take a look at that particular exercise and break it down into its component parts, subdivide it into coaching cues or skill sets, and then describe those. Okay, so the reason I do that is so that when they're coaching and working in rehab, they are able to break those particular exercises down, and if there's a deficiency or if there's some sort of improper motor patterning, then hopefully they would be able to identify that and address it with a specific exercise prescription. So in the case of throwing, we divide it into a stance, a preparatory, a movement phase, a follow-through, and a recovery. Okay, for every sports skill, that's going to be different, and depending on which resource you're looking at, you may see different descriptors. Okay, that's okay, but the point is, for you as a coach, as a clinician, as an exercise specialist, you have to be able to identify where these breakdowns in form are occurring. Okay, so in the case of pitching, we see the initial stance and the preparatory phase being isometric and then largely concentric. That movement phase being concentric followed by eccentric oftentimes, and then the follow-through almost exclusively eccentric in nature. So when we look at something like this, a kinematic analysis of pitching, so in the top left we see a lateral view, okay, with the pitcher throwing from the full wind-up position. So actually he's throwing from the stretch. We don't see the full wind-up position with his start. So we see that high knee drive, and then on the bottom we see how he is moving toward the target and moving into a stride from this stretch position. Okay, so in that wind-up, think about what he's doing anatomically and physiologically. What is he doing? Okay, we know that muscle tissue has an elastic property to it, and we know that connective tissue that attaches muscle and is interwoven within the tissue itself also has an elastic component. So that high knee lift and that kind of tuck position is preparing some muscle tissue, putting it on stretch. Okay, we see the hip moves into flexion. The shoulder is similarly flexed, and the elbow is also flexed in this initial preparatory position. Okay. As it continues, and we see him move into his actual throwing motion, in the top there you see that kind of layback that's common in throwers, that external rotation that we see at the shoulder. And in many instances, if you watch these high-speed film video captures of throwers, the external rotation that they attain during the throwing motion is greater than you can actually get on an examination table. If you were to measure his external rotation using a goniometer, he wouldn't be able to get there. Okay, so what's happening? Well, the momentum and that whipping action of the upper extremity is putting the musculature on the anterior chain on a stretch. And then he's subsequently concentrically contracting those muscles and releasing that stored potential energy to add to the power that he's able to produce. Okay, so at the bottom here we see kind of the peak of his release, where he's getting ready to release the ball. Now, some pitchers will release at varying degrees. Okay, so here's about a 2 o'clock release. If you've got a sidearm pitcher or even a submarine pitcher, then that's going to vary. But the point here is there's not necessarily a right way to do this. Okay, so some athletes will have success using different mechanics. Now we know this kind of overhand release is better in terms of valgus load on the elbow, and it protects the joints more so than a sidearm would or a submarine that exposes the shoulder to risk. So lots of times coaches will try to coach the athlete to release as high as possible for the sake of injury. And that's okay, but it's not a bad idea, especially to have a young thrower kind of experiment with that arm slot. And that's also something that we can see as evidence that they're starting to have pain. We'll see an athlete who ordinarily releases a little lower will go to a little bit of a higher slot to try to protect that elbow, for instance. And if we start to see changes like that unprovoked, it's not a bad idea to ask questions. Hey, you having pain? Or are you dealing with soreness, unlike in months or in outings past? Okay, so that shoulder external rotation reaches its apex, and then suddenly we whip into shoulder internal rotation as we begin to move through that motion. The shoulder is also fully extended in this position. The trunk is also extended. If you look through his spine, you see lumbar spine and pelvis are fully extended. Thoracic spine, fully extended. When we talked about the spine, we talked about the orientation of the facet joints and how they can influence that flexion or extension. So if you've got an athlete who's dealing with back pain, they might not like getting into that extended position, and lack of extension in the spine is going to manifest its way up the chain, and it's going to influence the way in which he's able to throw. Also, if you look at this anterior view, you see there's some lateral flexion away from the throwing side, okay, as a means of generating more torque. So in addition to flexion and extension, we've got some lateral flexion that occurs, and that's important to note. Okay, after the ball is released, basically we've accelerated that limb maximally, and now we have to decelerate it as rapidly as possible because momentum wants to take that arm and follow the ball to the plate. Okay, the forces on the shoulder joint are trying to essentially rip it apart. Okay, so during this follow-through phase, all of the posterior chain musculature is firing. It's like we talked about, contraction means shortening. However, it's trying to contract, but it's actually being stretched. The forces are greater, the resistance rather, due to that momentum is greater than the forces that the patient's able to generate, or the athlete is able to generate posteriorly, until he or she can decelerate that arm action. Okay, so from this position where there's internal rotation and then that follow through with some trunk rotation and further flexion, everything on the back side is trying to contract to slow that down. Okay, so we also see that shoulder internal rotation. This is a common injury in throwers, because when we get into this internal rotation position, we have a tendency to minimize the subacromial space. Okay, so we talked about the scapula and the acromion. The humeral head kind of takes up the majority of that space, and it can lead to early impingement syndrome if the athlete doesn't have proper eccentric control. So in terms of training and in terms of how those muscles need to be managed over time, we realize that most throwers are not ambidextrous. Okay, they're going to throw one side or the other, and almost everything they do is explosive concentric anterior and eccentric posterior. So we have to combat those things. So it's not a bad idea to have throwers doing things to kind of balance those forces out. So a lot of pitchers have gone to things like K-bands, which are elastic bands that will train bilaterally and also train anterior and posteriorly to try to work on balance, because what they're doing in the bullpen, what they're doing on the mound, has a tendency to lead to imbalances. Okay. We also see that arm come across the body into horizontal adduction. Okay, and that's going to be further exaggerated with some trunk rotation. If they're a right-handed thrower, they're going to rotate toward the left as a means of decelerating that limb. We also see the elbow flexes as the athlete follows through. That's to shorten that lever arm, which makes the eccentric control a little bit easier. The leverage on that joint becomes a little bit more manageable at that point. And so that is almost a passive process. It's not a conscious process. It's something that the athlete discovers over time. Okay, continuing with that recovery phase, after the follow-through, they basically have to reestablish a fielding stance. So we've got eccentric strength, continuing to decelerate that, and now we've also got some proprioception, where the patient or the athlete has to regain their balance, come from that stretch position to a straddle or a facing position to the batter. And so that all involves motor control of the posterior chain in order to be able to resume a normal fielding stance. So if we look at it all together, we can kind of see from a lateral view and an anterior view kind of what that looks like, from that high knee kick to the stride to the maximum windup to the peak of the ball release to follow through to recovery. Okay. So if you see a break in this action, hopefully at this point you can understand, okay, if that knee kick isn't what it ought to be, they're lacking hip flexion. Is that a passive restraint? They have tightness in the actual hip joint, or is the iliopsoas weak? Okay. In that external rotation, what are the external rotators of the rotator cuff? And if suddenly that position changes, now I understand that, well, maybe one or more of the rotator cuff musculature isn't doing its job. So being able to break down any given sport skill, whether it's pitching a baseball, shooting a basketball, throwing a javelin, whatever, if you break it into phases and you understand what's supposed to happen, it helps you analyze what's going on and hopefully identify any deficits that you might recognize. Now, this concept of the kinetic chain in the upper extremity tells us that an open chain movement is where the extremity is free to move in space. So upper extremity throwing movements are open kinetic chains. So throwing a baseball would be an example of that. So a lot of my exercises early in rehab, if I'm doing push-ups or I'm doing even bench press or other types of resisted exercises that are closed chain, they're not necessarily going to be reflective of what that athlete eventually has to do. So I might not do it right out of the gate, but eventually I want to have them performing exercises in space. That requires more proprioception. It requires more eccentric control in order to do that. By the same token, closed kinetic chain, when the distal aspect of an extremity is fixed, that is how the lower extremity tends to function. So something like a squat is reflective of what an athlete has to do for a vertical jump because the foot is fixed on the playing surface. Okay. So your task, should you choose to give it a shot is to pick any of the following exercises and kind of walk yourself through that given exercise and identify what the phases of that might involve. So something as simple as a bicep curl, for instance. You're going to start at the body. You've got a concentric phase and an eccentric phase without a lot of explosiveness. It's open kinetic chain. You know that the bicep is active in the concentric phase. And for a lot of students, they think, well, if the bicep is active in the concentric phase, then the tricep is going to be active in the eccentric phase. But that's not true. Think about what's occurring. In the concentric phase, the force that my bicep produces is greater than the resistance. So I'm producing force. Okay? By the same token, as I lower that weight, the force my bicep is producing is less than the resistance. So I'm controlling motion. If I just drop the weight, then I'm not producing any force. Okay? So something as simple as a curl oftentimes really just has two phases, a concentric motion producing phase and an eccentric motion controlling phase. And that's pretty simple. But when you start to apply that to a multi-step skill like shooting a basketball or throwing a baseball, it gets a little bit more complex. So I've listed a number of exercises there for you to look at. It wouldn't be a bad idea to take a shot at whether or not you could do those things. Okay? So when you're analyzing that exercise, identify what the agonists are and what they're doing. Are they functioning concentrically, isometrically, eccentrically? What are the antagonists? What are they doing? Maybe they're not doing anything. When I'm bicep curling, my tricep is an antagonist, but it's not really doing anything. I know that the more I contract my bicep, the less I'm able to activate my tricep. Okay? Are there any stabilizers? Well, yeah. Okay, brachioradialis is going to assist with elbow flexion. Maybe I've got some shoulder musculature that's going to assist. Okay, so think about whether or not there are synergists or stabilizers there. And then something as simple as flexion, we know that's sagittal plane, lateral axis. Okay, so this is going to allow you to use that knowledge and apply it in a more meaningful way. That's it for this time. Tune in next time for the very last lesson as we take a look at motion analysis for the lower extremity. Till next time, Dr. B signing out.